Now that you have already been introduced to the intercostal spaces and intercostal muscles, let's dive deeper and find out more about these muscles. So, it is the intercostal muscles that fill the intercostal spaces present between the adjacent ribs. Now, they are in fact 3 flat muscles that are named in accordance with their position: external intercostal muscles, internal intercostal muscles, and innermost intercostal muscles. Let's start from the most superficial one, the external intercostal muscle. Well, the fibers of external intercostal muscle run anteroinferiorly, that means downwards and forwards, originating from the inferior margin of rib above and inserting into the superior margin of rib below. These muscles extend around the thoracic wall from the vertebra posteriorly to the costochondral junction interiorly, as you can see in the video. And this is where it becomes the thin anterior intercostal membrane. Now, sandwiched between the external and innermost muscles are the internal intercostal muscles. They originate from the lateral edge of costal groove of rib above. In contrast to what we saw in external intercostal muscle, the fibers of internal intercostal muscles run posteroinferiorly. That means downwards and backwards, and then insert into the superior margin of rib below, deep to the attachment of the related external intercostal. This muscle fills the intercostal space from the sternum anteriorly to the angles of the ribs posteriorly, and here, it becomes the posterior intercostal membrane and reaches the vertebral bodies. Now, lastly, we have the innermost intercostals. That are the deepest of the 3 muscles. Well, their fibers course in a similar direction as the internal intercostal muscles. That means they run posteroinferiorly. They are poorly developed in the upper thoracic levels, but become progressively more pronounced in the lower levels. These muscles originate from the medial edge of costal groove of rib above and insert into the internal aspect of superior margin of rib below. Innermost intercostal muscles are divided into 3 portions, which are more or less separate from one another. The anterior portion is named as the transversus thoracis muscle. The lateral portion is the innermost intercostal muscle, and the posterior portion is the subcostalis muscle. Now, the intercostal muscles need innervation by the related intercostal nerves to perform their action, and their primary action is to provide structural support for the intercostal spaces during breathing. Not only this, but they help in the elevation and the depression of the ribs during forced respiration. Also, during respiration, the tissues of the intercostal spaces are strengthened by the tone of the intercostal muscles, so that when intrathoracic pressure is increased or decreased, it prevents the sucking in or blowing out of the tissues. So, that was about the external, internal, and the innermost intercostal muscles. But do not go anywhere. Just click the next part of the video to learn about the blood supply and innervation of thoracic wall.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.